Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success with a 99% pass rate on all courses for nearly 10 years. Now, I always like to get into my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here are I have designed and created based on what is currently being tested on the ANCC and AAMP exam. Now, any of the videos that you may see, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a patient presents to the office today with complaints of bumps to her fingers. She has a history of hypertension and arthritis. Upon examination, the nurse practitioner notes nodes to the distal interphalangeal joints bilaterally. Based on these findings, how should the nurse practitioner diagnose? Is it A, psoriatic nodules, B, Herberdin's nodes, C, Bouchard's nodes, or D, scabies? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is really being asked of you, okay? So here the stem of the question states, based on these findings, how should the nurse practitioner diagnose? I always say if it's asking for a diagnosis, you need to run it back and look at the assessment findings. So here this patient came into the office complaining of bumps to her fingers. She has a history of hypertension and arthritis, and on exam, the nurse practitioner notes nodes to the distal interphalangeal joints bilaterally. So we know that when we're talking nodes and we're provided with specific locations, especially distal and proximal interphalangeal joints, we begin to think of Herberdin's and Bouchard's, especially secondary to patients with arthritis, right? And here, based on the location distally, this is diagnosed as Herberdin. So B would be your best answer because Herberdin's nodes are typically found at the distal interphalangeal joints, whereas Bouchard's nodes are typically proximal. Okay. Question number two for today. A patient presents to the office with complaints of wrist pain after a recent fall. She states that she tripped when leaving the grocery store. She states that she misstepped off of the sidewalk and attempted to catch herself from falling by extending her arms and injured her wrist when she fell. Injured, not ignored. Upon examination, the nurse practitioner notes edema to the right wrist and inquires as to when the fall occurred. The patient states that the fall occurred 2 days ago. What is the next best step by the nurse practitioner? Is it A, NSAIDs, splint, and have the patient to return in 2 weeks? B, NSAIDs, splint, and have the patient's wrist x-rayed in 1 week? C, obtain an x-ray today? Or D, NSAIDs? Take a moment and tell me what you got in the comments. All right, so here the stem of the question states, what is the next best step by the nurse practitioner? All right, so what are we doing here? This patient came in, she's complaining of wrist pain, recently had a fall. She states that she misstepped coming out of the grocery store off of the sidewalk, attempted to catch her fall, brace herself by extending her arms, and she injured her wrist when doing so. The nurse practitioner notes edema and states that she asked about when the fall occurred, and it was 2 days ago. So, what's the next best step by the nurse practitioner? So, here, this is classic of a potential scaphoid bone injury. Could be a navicular fracture, right? And so, we know that we want to do something now, right? So, giving her NSAIDs to reduce the inflammation and splinting that wrist, but also being aware that we won't see the actual fracture of that scaphoid bone. It takes typically a week to appear. So you want to have them to return in 1 week to do the x-ray. Doing the x-ray now will not be a benefit. It will be a false negative, right? So the best answer is B, provide NSAIDs, a splint, and have the patient to return in 1 week for x-ray, okay? All right, lastly, question number three for today. The nurse practitioner is working to confirm a suspected diagnosis of de Quervain's tenosynovitis. What is the best test to complete to confirm this diagnosis? Is it A, Tenel sign, B, Finkelstein test, C, Phelan sign, or D, a scaphoid x-ray? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question states, what is the best test to complete to confirm this diagnosis? So, okay, what are we doing to confirm the diagnosis and what is the diagnosis? So here, they're suspecting de Quervain's tenosynovitis. So you need to know that gold standard exam and diagnostic test that is done to confirm a diagnosis. So if you are stuck, you want to start to do process of elimination, right? So Tennelle sign and Phelan sign, we know we do that for carpal tunnel, right? Those are the two common exams that we do to confirm a diagnosis of carpal tunnel. So we can eliminate A and C. Scaphoid X-ray, that's more so with a navicular fracture. Finkelstein test is the test that we do to confirm a diagnosis of de Quervain's tenosynovitis. The Finkelstein test, we do by having them to make a fist, but make the fist with their thumb in the inside. So thumb folded in first, folding the four fingers over, and it will elicit pain if it's a positive finding for de Quervain's tenosynovitis. So your best answer is B, the Finkelstein test. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure to meet me back here. Subscribing is free and it allows you to receive notifications every time that I post, be it videos on daily practice questions, any of my topics and tips videos, any of my flashcard Fridays, and any quick tips that I may post in the community. Also, membership access is available if you're looking for extended questions weekly to do more than the three that we do daily. Join the membership as well. It is $9.99 to join. If you need any other resources from the nursing studio, feel free to give us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. The few things that I offer, I do have a review book. There's an ebook option as well as a paperback option, and both are linked in the bio of this channel. The ebook, of course, once purchased, provides you access on any of your devices immediately, and the paperback will be shipped to you from Amazon, okay? Next, if you're looking to do an independent self-paced review designed for family and adult Gero for both exams, that is also linked in the bio of this channel. I have the 5-week review. You will see that group link for our September class up and coming. I will notify you once I start the enrollment for that. And then if you're looking for one-on-one sessions, I have a few options, but I always say reach out to us either by calling or emailing because they are customized. So I like to truly gauge what you need. There is an option if you have a particular weakness, you can book a session with me for 1 to 2 weaknesses per session. So say you want to go over the GINA asthma guidelines and hypertension, you can book a session to do that. If you're needing an exam or readiness assessment, you can book a session for that, or the custom package, which is designed. You're provided a pretest to assess your exam readiness and where you are currently. And then based off the time that you have designed and want to study during that duration, I structure a study plan for you and work alongside you during that time frame to take you to a successful exam attempt. Okay. So if you need any of those resources, feel free to reach out to Nursing Studio. But as always, make sure you meet me back here. Happy studying. Bye, y'all.